What I'm going to tell you today about chronic pain, you probably weren't aware of. I know at least my patients, my patients that I have, hardly any of them are aware of um, chronic pain in the way that I explain it. Um, I'm a licensed clinical social worker. I'm not a physician, so I do not diagnose, or treat any physical problems whatsoever. I'm not trained to do that. I'm not qualified to do that. What I am qualified to do is help people with behaviors, attitude, emotions, thinking, learning, training, and motivation to do those things. And so, my background, I've been a clinical social worker for like 25 years. I'm licensed, I'm board certified, so I'm qualified to talk about those things. What people often don't understand is the connection between mood and chronic pain. Everybody understands that chronic pain, say um, knee pain or back pain, that's, medium pain or high amounts of pain, that it affects your mood. It, it's frustrating. It makes us irritable. We get depressed and sometimes even anxious because of that pain, right? Everybody understands that direction of how pain affects mood. What we often don't consider is that pain actually goes the other way as well. In other words, mood, your emotional state, affects how you perceive pain. In other words, if you're in a good mood, um, that you feel relatively little pain. When you're doing something pleasurable, you perceive less pain than when you're frustrated, upset, anxious, or depressed. So that introduces another idea, is that if mood affects the amount of pain that we feel, and the gate theory of pain actually backs this up, so it's well researched. If mood affects pain, then what if we could improve our mood when we want to? Now, you need to watch my video on entitled "How to Improve Your Mood Instantly" to get uh, acquainted with where I'm at. You need to read my article, "Depression is a Liar." I'm gonna write a follow up to that called "Anxiety is a Liar," um, because it talks about the different ways you can improve your mood. There's several different ways to do that: rewarding activities, increasing physical exercise, challenge upsetting thoughts. Um, in other words, what we say to ourselves is very, very important. If you can challenge those thoughts and self talk, what you say to yourself, you can actually improve your mood quite a bit. Um, the other way, the last way, the fourth way to improve your mood is relaxation. And that relaxation slash prayer slash meditation and breathing techniques. So rewarding activities, pleasurable activities is one. Two, increase physical exercise. Three, increasing physical exercise is actually increasing physical exercise is actually the number one way to improve your mood. It's very, very, very simple to do that. Um, and if you think about that for a second, it's actually pretty cool because you actually did nothing to change the stressful situation, yet you were able to improve your mood, which is a pretty interesting concept by itself. Um, and so that was this increasing physical exercise, the second one. Three is challenge upsetting thoughts. We'll talk about that more in detail. And then four has several different methods, all basically lowering physiological stress in order to improve your mood. Relaxation, breathing techniques, prayer, and meditation. Um, there's a fifth category. I feel silly for forgetting it, but I actually forgot it until today when I was talking to a patient because I realized that problem solving, um, you either basically, some of these techniques, they fall into two categories in my opinion. And it's either change change your mind about a stressful situation or solve the problem directly, right? Um, we can get into that more in detail later, but let me give you some examples of improving your mood, how it can help you um, improve perceptions of pain, right? Just going to give you examples of patients that I have. So I have a mid-grade enlisted active duty, mid-career active duty female with headaches, neck pain, and anxiety. Um, I helped her improve her mood by convincing her, one, to stop drinking. This stabilized her mood and improved her sleep. Um, but she also increased her physical exercise, and I taught her how to do relaxation breathing, and she engaged in self-massage of her own shoulders and neck. Now, uh, in training her to, in talking, educating her, and then training her how to do that, uh, the first time that she did it, it worked for her, but she was doing it after work. Um, Interestingly, she didn't know that it's possible to be successful at work and also be relaxed and not tense. She only knew she still basically is just learning how to be relaxed and productive at work. Very interesting case. It brings up some pretty interesting concepts that I talk to patients about, successful patients in their careers all the time. That this idea about um, being tense and upset in order to be successful. It's just a part of our society, but that's not the main point. The point is improve your mood and you can improve perception of pain. So she is having much better sleep now. Her mood has improved, and her pain, her headaches, the tension in her neck, and her anxiety are all but pretty much gone. It's not a problem for her anymore. I'm continuing to work with her as we speak. Um, I'll probably be continuing to work with her for another 3 or 4 sessions before I think she'll feel really comfortable with what she's doing and being able to do it herself. The second patient I want to tell you about is a senior active duty officer, male. He wrote to his doctor that he was having chronic pain in his back and shoulders and anxiety about that, depression, and trouble sleeping, insomnia. Um, I helped him improve his mood by a medication evaluation referral. So I am noticed how depressed he was, and I said, you know what, you could probably use an antidepressant. Um, I don't like to rely on that option, but if a patient if a patient can benefit from it, I'm definitely gonna refer the patient back to his doctor for that for a medication evaluation. Uh, let's see. So um, I referred him back to his antidepressant. His doctor at that time also came up with a different pain medication, and within 2 weeks, his reported mood was normal. Now, he had suffered from anxiety and depression for a decade. This is a senior um, active duty officer. who has been very successful in his career, but he had been suffering for a decade. And when his pain decreased, his mood improved, which is exactly what the gate theory of pain predicts and what I've been finding in my patients. So, um, when I saw him, uh, or, or I was in reviewing his case, within 2 weeks, his reported mood was normal and he was denying any pain at all, which is incredible to me. I mean, that's incredible. But um, given the history of his problems, when I saw him 6 weeks later, his pain numbers were improved by 33% for current pain, a 50% improvement in insomnia caused by pain, so trouble sleeping caused by pain, 71% improvement in pain impacting his mood, and an 80% improved um, for pain impacting stress, and 29% improvement in pain impacting activities. His scores on a depression scale, he had when the first score I got was for mild depression on the 31st of August, and by 14 September, his depression score was 2. That's a 78% improvement in depression symptoms in 6 weeks. Pretty cool. Um, his anxiety score on the 4th of August was moderate at an 11, and on 14 September, when I saw the patient, I did not measure with the GAD-7, but the patient denied having any anxiety symptoms at all. Uh, that's just, I think that's fantastic. So I'm seeing a senior um, active duty officer. I saw her for the second time today. Um, she complains of headaches, anxiety, and depression. Um, I'm gonna leave a lot of the details out, but basically, how I'm helping her now, how I'm gonna help her now is one, explaining to her that if we can improve her mood, we can improve her pain, her headaches, and her anxiety. But um, I can also, I just talked with her briefly today about solving some problems. At home, helping her solve a particular problem at home, just a logistical problem that makes her feel overwhelmed, and a big problem at work where she feels overwhelmed in certain circumstances. And I'm not going to really talk about what those circumstances are. But the idea is, once I was able to zero in on what the worst problems were, why she was having anxiety and headaches, then it's just really a matter of uh, coming up with creative solutions to help her in those situations at home and at work. And they're very, very fixable problems. It's just that, sometimes you get locked in and you can't come up with solutions to problems. So I'm very, very hopeful. I had her read Depression is a Liar. She's going to watch How to Change Your Mood Instantly, which is my first motoblog. And then the second motoblog is Old Bike, New Attitude, which is a cognitive intervention. Because these ideas help people uh, improve their mood. They're very simple techniques. Once you explain it, like I'm doing right now, people get it, and they're able to put the entire picture together. Speaking of putting the entire picture together, what I've prepared for you is a brief slideshow um, that summarizes the ideas that I just talked to you about. Enjoy. So, as a quick summary, improve mood and you can improve pain. As, as your mood gets worse, your pain will get worse. So what we want to do obviously is improve and stabilize your mood because your pain will decrease, and when your pain decreases, your mood will improve, um, and actually stabilize even more once your pain decreases. We only need one method out of these four in order to have some improvement in pain and improvement in our mood and then decrease our pain. But the more we use, the more powerful um, the effect of the improvement, and then it'll stabilize for longer. So if we can use more of these methods, great. So here's an example of increasing rewarding and pleasurable activity. It's a very easy thing to do. Um, Hugs, kisses, touching. It's good. It's very good for us. It gives us a high. It's good to touch other human beings appropriately, of course. Um, and then a hobby, relaxation breathing, prayer, meditation. These things are all behaviors. Uh, we say this to ourselves. This is thinking. It improves our mood. We feel good. And then our pain is decreased. Notice, pain is decreased. It is not gone. It is still there, but it's decreased. So here's another way of showing how rewarding activities, pleasurable activities, that interacts with everything else. Everything can interact with the other things. So if you improve one, you can improve all of them. If one gets uh, uh, if one gets worse, it worsens all of them. So let's increase physical exercise. Here's a easy way. Increasing physical exercise is a very easy way to improve mood. It's well known that works. The problem is that people do not pace themselves, or the expectation and the belief that activity is a mismatch for their current physical condition. And so just saying, you know, improve your exercise, that's it's not great guidance without understanding what the expectations of the person are, right? So after college, after getting coming into the army, I used to do Saturday morning basketball with the young kids, and I was 24 years old at that point. I was not in as good a physical condition as I used to be in college when I was running track, but worn out knees, worn out hips from running for years and years. It was a mismatch for that physical activity. So just increasing the physical exercise was not a good it wasn't a good thing because it was a mismatch. What I should have been doing and what I started to do later was I matched things up with I matched up my expectations and beliefs with the physical exercise. See, lots of people who cannot accept their current physical condition and they try to engage in activities that are a mismatch, and it leads them to feeling depressed and anxious, and it makes this worse. It makes it much, much worse. And so when we do get a match, so when I started golfing, walking for 4 hours, 5 hours on a slow Saturday morning with the rest of the old guys, um, everything started to match up with my expectations and beliefs, and it was great. You meet a lot of you know the switch to golf was it was a big big turning point in my life. But all of us have to come to that realization that our bodies are changing, right, over time, or we wore them out. We need to match these two, or else this will come bite you. So once you match it up, these things, it doesn't disappear, but it gets a lot better. Um, Relaxation, self-massage. This is a good one. So these are hard because we got to match up the expectations. It's not difficult to meditate or engage in prayer, but if we're doing, if we're not matching up the right expectations, then this never works. Um, People think they go into it with the expectation that it's going to relax you 100%, your pain's going to go away, and that's going to be that. Well, that's that's not going to get us the outcomes that we want, right? Dear God, make me 100% pain free and feeling like a 20-year-old again. I mean, dude, you're 50. There's a better way. So we need to match this up with our physical condition. If we match it up with reality, then we this works. This absolutely positively works very well. So if we match it up with, look, this is designed, these things are designed to take the edge off the stress and the body tension, which will allow me to relax, feel better, and then reduce the chronic pain. Um, you know, dear God, give me strength and wisdom. Give me strength and wisdom to work on realistic expectations. We feel better, we're at peace, and then once that happens, once we match things up right, we feel better. Notice the pain is still there, but you feel a lot better. The pain improves. Thinking is the last one, and uh, what we're saying to ourselves. So a lot of people say, they kind of want, with specifically related to pain, doc, just make the pain go away. It makes you feel crazy. Um, it's a bad place to be. Pain sucks, and then you definitely don't feel like engaging in rewarding or pleasurable activities, and so you don't do them. So you have more chronic pain, and that's all you want. You just stay focused on make the pain go away. Now, it's not just pain situations that lead to um, our mood being messed up. Some of the other things that we say to ourselves are, uh, I have to be tense at work. I gave that example earlier in this video. And then I can't solve this problem. People say that to themselves. I feel guilty. XYZ died. Um, Lots of people die in the military business. But I've had two patients. They're uh, one is ex-military, whose their mother passed away, and both patients had a lot of guilt surrounding the death of their mother. Um, uh, and then here's another example of something that worsens our mood is I'll never feel good again. Um, so bad outcomes. The pain increases, and it's just a mess. So this is how we challenge upsetting thoughts. Um, I have to be tense at work. So somehow I learned how I worked with this patient was somehow I learned to succeed by being tense and nervous at work. That's a reinforcing concept. Once you gain rank and status and um, your first job in your life, uh, you're doing well, being productive, and people praise you and you get awards. Of course, like it's reinforcing that you would be tense and nervous at work. And so, but you can definitely learn to be more relaxed and still be good at what you do. That's a really important concept to understand and then do. We got to do things that reinforce uh, being more relaxed and productive at work. I can't solve X. We've all had problems that were tough to solve. Somebody somewhere else had this problem, so I'll figure it out with a little more time and patience. And that's usually what it takes: a little more time, a little more patience, and we eventually figure it out, and our mood improves. Right? That's what we're after is that improving that mood and stabilizing our mood. So with the guilt of somebody else dying, um, what I told my patients is you did not do anything to make your mother die. There's nothing that you did that made that person die. And at the same time, feeling sad is not feeling sad is normal. that they lost their life, it's somebody that you're close to. So feeling sad about that is completely normal. It's just incredible to me how many people don't give themselves room uh, to feel normal, completely to have normal emotions. Um, and they actually mix the two emotions that they, of guilt, the guilt that they didn't do anything wrong, but they mix sadness and guilt, and the two are connected. They become connected. It's not the same thing as feeling guilty, but yet people get confused between the two and they feel both, and then they wind up feeling guilty of even moving on with their life. It gets very confusing for people, and I try to help them to pull those two things apart. Feel normal that you're sad, and then I'm not sure why you feel guilty about something that was not your fault. Um, I'll never feel good again. So, with a little bit of work, um, yes, you can definitely improve your mood and decrease some of the pain. And the medicine, the remaining medicine that you have, will also help you with part of the pain. So these are more realistic thoughts and more balanced thoughts. And the last thing I want to kind of leave you with is that there's levels to this. So if you can recite these basic models and examples, it is possible that you can have some improvement in your pain, but it's probably unlikely by just understanding and reciting these basic models. Instead, at the intermediate level, purple, brown belt, if you can demonstrate understanding and use one or more methods of improvement, such as relaxation, you only need one, but relaxation, breathing, prayer, meditation, or challenging, upsetting thoughts, or increasing rewarding activities. For most people, this level is all you need for significant pain relief, significant chronic pain relief. Now, um, if you want to go further and um, use all of the listed methods of mood improvement and demonstrate increasing and decreasing the dosage, which this increasing the dosage, frequency, duration, and intensity, that would be its own video. In fact, I might do a video on being at advanced level. So frequency is increasing how often you might do some of these things, relaxation breathing or challenging upsetting thoughts. Duration is how long you do it, and intensity is like turning up the volume on music. So say you enjoy listening to music, right? Increasing a rewarding activity. You would increase the intensity by turning up the volume. I think I'll probably do a video on advanced, uh, the advanced form of this. And then, red stripes on your black belt. Teach others. If you can teach somebody else how to do this, you definitely you're you're up there. There's no expectation. There's no expectation at all for a patient or somebody who needs pain relief to be at this level of skill and knowledge. But I thought that I would put it on here because I think it's interesting. Um, and if there's other behavioral health practitioners who are watching this, you might be interested in going further. I can help you with that actually. Contact me. Now, two videos that I've made about overlapping with this topic. Um, Like New Attitude, it's about cognitive changes. It's a fun video. It's pretty cool. And then my first motoblog was um, change your mood to change your mind. How to change your mood instantly is basically what this video is about. Give me some feedback on this video. I need your feedback. I need your ideas. What did you think? What are your thoughts? Anyway, I appreciate you. I really appreciate you watching, and see you next time.